Many a times in the comment section, I have seen people asking about W sitting. Is it good? Is it bad? No, what should I do? Let us see the answers in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related explanations are provided via videos which are released every week. If you want to see such videos, kindly subscribe to this channel. Also, if you have any queries or topics on which explanations are to be given, videos to be made of, kindly put it in the comment section. I'll try to make videos on them in subsequent weeks. This week's video is about W sitting. What is W sitting? A young child often sits on their bottom, knees out in front, with legs and ankle outwardly spread. When you see from above, the child's position appears like a W. That's called W sitting. There is a heated debate on the internet among people that this W sitting is bad. No child should sit in a W position. Okay, this denotes a serious abnormality. If you sit in this position, something bad will happen in the future. All those things are there. What are the things people are worried about? People are worried about in towing. When children tend to walk, some children tend to have a pigeon toe, or their toes are pointed towards the inside. So this pigeon toeing occurs because of W sitting. Similarly, people attribute many hip and trunk abnormality, weakness of muscles, long-term pain problems to this W sitting. Hip dislocation in children, which can happen because of developmental dysplasia of hip, a congenital condition. In this condition, your hip, to broadly say, is weak. Let us say it is weak. So it can get easily dislocated. In this developmental dysplasia of hip, that is children with DDH, W sitting often promotes dislocation of hip. These are the problems attributed to W sitting. Are they true? Are they 100% true? Is W sitting that bad? Is W sitting the sole reason for all these problems? We have to understand, why do children sit in this position? Often during the normal course of development, a 1-year-old, a 2-year-old child may sit in this position. There are various sitting positions, like you can sit long sitting with your legs thrown straight. You may sit cross-legged, crisscross like applesauce. So those sort of positions, or you may hang your legs from a stool, or you may sit in a W position, or you may kneel. Okay, so all these are, or you may sit side-legged, both legs towards one side. But this W position implies femoral antiversion. In simple words, your femur or the thigh bone is slightly tilted towards inward. So that's why the children are able to sit in a W position, but for others, for adults, it might be difficult. This femoral antiversion normally corrects as they get older. So this W sitting also will improve as they get older. This is a normal phenomenon. But if the femoral antiversion or the thigh bone tilting inwards is more, it may result in your in-toeing or pigeon toe walking. So other orthopedic and muscular problems. So does W sitting cause femoral antiversion? Usually it is the other way around. Because of femoral antiversion, children are able to sit in W position. So that is the truth. So the idea that W sitting by itself is going to cause a lot of problems by scientific studies is unfounded. But absolutely, this is not a usual or a recommended position for sitting. If your child sits in this W position sometime, but usually sits in other positions also, this is not something to be afraid of. So that's the clear takeaway, that this is not a favored position. But if your child sits only in W position, and is not able to adopt other positions of sitting, then this might result in your core muscles, trunk and hip muscles not getting stronger. Why? Because in W position your base is wide, you need not develop balance that much. Okay, you are sitting on your bottom, so your core muscles are not getting activated. That's why this is not ideal. So what can be done? If your child favors this position often and always, then you can advise the child gently by telling or showing pictures of a cross leg position or long sitting, and you can say that this is going to strengthen your muscles. Don't force, but gently coax your child into sitting in other positions. But if this W position is associated with developmental delay of the child or any muscular problems in your child, then this might denote a problem which needs to be corrected orthopedically, okay, either by therapy or even by surgery. This is usually done only after 10 years of age, but anyway, by surgery. So this can be attempted if your child sits only in W position and not able to alter the position. Even with advice, the child is not adopting other position and often associated with other abnormalities. But merely sitting in a W position, a 2 or 3-year-old child for some time doesn't denote any abnormality at all, because children have an inherent femoral antiversion. That means their thigh bone is turned inwards, and as they grow, this gets corrected by itself. A young child is able to sit in W position. This is not an abnormality. So a doctor's visit for this condition is required. As I said, if the child has delayed development, if the child has pain because of that, if the child has poor muscle tone, your child is flabby, has the tone of the muscle itself is flabby. Otherwise, occasional W position is harmless. No, even though internet or some sites may say that no, this is a position which needs to be avoided at all costs. It is not true. Extensive studies have revealed that this is usually a behavior which gets better with age. And if your child is able to sit in other positions, it is nothing to be worried of. Hopefully, this would have cleared your confusions regarding W sitting. If you found this video useful, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.